Hello, I'm Laura Judd-Glossy, pediatric psychologist with the International Center for Colorectal and Urogenital Care at Children's Hospital Colorado. I have the privilege of providing psychosocial support to patients with colorectal conditions and their families during clinic visits as well as on the medical floor before and after surgery. Patients with colorectal conditions often experience fecal incontinence. We know that the longer a patient experiences incontinence, the more likely they are to develop behavioral or emotional problems. In a recent study that we conducted with adult patients with colorectal conditions, more than half of them reported symptoms of anxiety and depression. Thus, we feel it's important to address not only the physical symptoms, but also those related to psychosocial functioning. When working with patients with colorectal conditions, it is important to consider the age and developmental level of the patient. Young children benefit from simple and concrete information. It is important to use language that is familiar to a child, such as describing a catheter as a tube. Patients at this age often benefit from distraction during medical procedures. Many families find it helpful to allow their child to use a special toy or game only during medical care in order to pair a highly preferred activity, such as watching a show or playing a game on an iPad, with a less preferred activity, like an enema. As children get older and have a broader understanding of their body and medical condition, it's helpful for them to understand the rationale for medical treatment. For example, when describing the need for oral laxatives, a parent could tell their 5-year-old son or daughter that you'll be taking medicine every day to help your body poop so you have fewer accidents. In addition, behavioral incentives, such as sticker charts, can help improve a child's adherence to their medical regimen. School-age children are often quite aware of how they are different from their peers. Parents can help patients understand that their colorectal condition is only one part of them, by encouraging them to pursue hobbies and activities that interest them. It is also important for caregivers to work with their child's school team to ensure that the child has the appropriate support, such as having the opportunity to use the bathroom whenever needed and having an extra change of clothes available. Chronic medical conditions, like colorectal conditions, can make it challenging for teens to become as independent as they would like to be. Within the medical setting, we encourage families to include their teen in decision-making and also give them an opportunity to meet with their colorectal provider alone if they wish, so that they can ask questions about sensitive topics. In addition, it can also be helpful for teens to meet other youth with similar medical conditions in order to help them feel that someone else gets it. This can be done through participation in special camps that are geared towards youth with medical conditions or through online support groups. Finally, for young adults and above, we often discuss how and when they feel comfortable disclosing their colorectal condition and medical care to peers and romantic partners. It can also be helpful for adults to be aware of workplace accommodations that can facilitate success within the work setting. These are a few examples of how we provide psychosocial support to our patients and families. Please feel free to reach out to us if we can be of assistance.